Welcome to this video made for me. In this video, we'll learn about the menstrual cycle. Starting from the beginning, I will teach the stages of menstrual cycle and also the about ovulation. So let's start. So menstruation. The word menstruation. This word menstruation is derived from the Latin word called mensis, which means that month, and it is derived from Greek word that is mean. So what does it mean? Mean means moon. So these are the two terms from where the menstruation term is derived. Now this menstrual cycle, it is actually a cyclical, physiological cycle. It is cyclical physiological uterine bleeding, and it is due to the shedding of endometrial layer, due to shedding of endometrial layer. And why does it happens? It is due to interplay of hormones, due to interplay of hormones through hypothalamo pituitary ovarian axis. This is termed as HPO axis. Okay, now we will explain in detail about this cycle. So at first, this menstrual cycle, actually it is the duration is menstrual cycle duration. Its duration is around 28 plus minus 7 days, that is 21 to 35 days. And the bleeding time is around 2 to 7 days. And during this, around 20 to 80 ml of blood is expelled from the body. Okay, so if there is any abnormality in the duration or in time or in amount of blood, then the menstruation is abnormal, and it is known as abnormal uterine bleeding. Okay, so now we will talk at first that the menstrual cycle, this menstrual cycle, it begins at the age of 10 to 16 years, and in different regions, in some places like in Arab countries, or where there is a very high temperature, high humidity, menstruation occur earlier than the expected age. Like there can be menstruation before 10 years. Okay, and in some regions like where the temperature is very cold, at that places the menstruation can occur beyond the 16 years. And at average we take of around 13 years of age is the average age for menstruation. And we consider there are there is actually 28 days average duration of menstruation. And the first day of bleeding, is considered as the first day of menstruation. First day of bleeding is considered as first day of menstrual cycle. Now we will learn that there are three phases of menstruation. At first, the first one is the bleeding phase, which is around for 1 to 4 days. The second one is the proliferative phase, which is around 4 to 14 days. And the third one is secretory phase, which is around 14 to 28 days. Now we will learn about mechanism of the menstrual cycle. The first time when the female get her menstruation, that time is called as the first time it is called as menarche. Okay, so during this age, what happens? The hypothalamus, our chief leader is the hypothalamus. Okay, this hypothalamus releases one hormone that is called as gonadotrophin releasing hormone. This gonadotrophin releasing hormone stimulates the pituitary gland. And there is one important question in exam, that is which pituitary gland? Then it is anterior pituitary. Okay, anterior pituitary. Now, after stimulating the anterior pituitary, it releases one hormone that is called as follicle stimulating hormone. It means that there is follicle stimulating hormone. So in ovary, there is a lot of follicles. I will draw here, like if we consider this as ovary, then in ovary there are a lot of follicles. Okay, so if we draw follicles, then it is like this. Draw with me. These are the follicles, and it contains the oocyte. It contains the oocyte. Okay, so if this is a follicle, then these are what? These are the granulosa cells. These are what? These are the granulosa cells. So when hypothalamus releases the gonadotrophin releasing hormone, and it stimulates anterior pituitary to release follicle stimulating hormone, this follicle stimulating hormone stimulate what? Where does it act? It act on these follicles. It act on these follicles. On which part? On granulosa cells. So it act on the granulosa cells of the follicles. Then it releases estrogens. It releases? It releases estrogens. Okay, now I will write here like that. In ovary there are a lot of follicles. Okay, there are a lot of follicles in number of millions. Okay, and they started to convert from one follicle to another follicle. Okay, so they convert in this way. So at first there is the primordial follicle. There is primordial follicle. This primordial follicle get mature to primary follicle, and this primary follicle get mature to secondary follicle. Now at some time, the the amount of follicle stimulating hormone decreases. So at that period, when this FSH decreases, at that period the follicles which are having the highest number, or which are having the maximum number of follicle stimulating hormone receptor, they survive. Other follicles, they become atretic. Now the follicle which survive, we name them as the mature follicle. And it is also called as antral follicle. Okay, so this antral follicle is the one which will later get ovulated. Okay, so this mature follicle produces the high amount of estrogen. This mature follicle that produces the high amount of estrogen. When the estrogen number get reach to maximum, that is about more than 200 pg per ml, then there is release of LH. Where does get LH released from? Then this LH is released. This is released by pituitary. This is again which pituitary? Anterior pituitary. Okay, this LH is produced by anterior pituitary. So when there is a high amount of estrogen, then there is LH release, which is by the anterior pituitary. And when the amount of LH level get increased to the maximum amount, then there is LH surge. There is LH surge. LH surge means excessive amount of LH is produced. Okay, so during this LH surge, there is a LH number increased by more than 10 times, which is 24 to 48 hour before ovulation. So before ovulation, the LH level increases to more than 10 times. Okay, and LH source occurs, and after 24 to 48 hour, ovulation occur. After 24 to 48 hour, ovulation occur. So the day during which ovulation takes place is usually 14 days on average. 14 days at 14 days. Now during ovulation, there is, if we consider this as a follicle, then during ovulation there is excessive amount of pressure is created inside this follicle, due to which this ovary, this oocyte get released from the initially, if this is the antral follicle, then later on the pressure is increased so excessively that this oocyte get released from the follicle. Okay, so during this process, while the pressure is increased, there occur pain in the patient. And when this oocyte is released, there are fluids in this follicle. So these follicles are also get released into the pouch of Douglas. Where? Into pouch of Douglas. Fluid get collected, and it irritate the peritoneum, due to which pain occurs, and the pain which is occurred during the mid menstrual cycle, this pain is known as middle-Schwartz syndrome. Middle-Schwartz, check out the spelling, middle-Schwartz syndrome, which is mid menstrual pain. Okay, so ovulation occurred at 14 days of the menstrual cycle. Now we know that the estrogens which are produced in the beginning phase, what do they do? So they help in the proliferation. They do the proliferative change on endometrium. Okay, so the estrogen, what does it do? It do the proliferative change on the endometrium. And when there is the high amount of estrogen, this high amount of estrogen negatively, it gives negative feedback to the this hypothalamus and anterior pituitary, so that the gonadotropin releasing hormone and FSH will not be produced, and there will no further maturation of this follicle. Okay, so there is negative feedback mechanism by the estrogen, and the estrogen which is produced, it do the proliferative change in endometrium. Now we have to know that after ovulation, so if this is the ovary, remnant of the ovary, okay, if this is the remnant of ovary and the oocyte is released, the remnant of follicles, okay, this is the remnant of follicles and the oocyte is released here. So this remnant will be known as the corpus luteum. Now this corpus luteum, it will release hormones like estrogen. It will release hormone like estrogen, progesterone. Okay. So now this progesterone will help in secretory changes in endometrium. The estrogen was for proliferative change and this progesterone is for the secretory changes in endometrium. What does it mean? That the blood vessels which are in the endometrium, they will be coiled, tortuous, dilated. The number of glands will increased. Okay, smooth muscles number will be increased. So there is the secretory changes in the endometrium. Now this oocyte will wait for the spermatozoa to come. What does it will do? It will wait for spermatozoa to come. Now there is two conditions. If the spermatozoa comes and the egg becomes fertilized, if this egg becomes fertilized, and one condition is if egg is not fertilized. So up to this, if there is these are the three layers of the uterus: perimetrium, myometrium, and endometrium. In endometrium there are two layers. In the endometrium. They are the stratum functionale and stratum basale. One is stratum functionale and another is the stratum basale. Okay. So in the endometrium, in stratum functionale and in stratum basale, there occurs the initially proliferative changes. Okay, later on there occur the secretory changes. Now if the egg becomes fertilized, then this fertilized embryo, okay, this embryo will release the HCG hormone, which is called human choriogonadotrophic hormone. This HCG, it will release by the it will be released by the syncytotrophoblast. Syncytotrophoblast of the embryo. And what it will do, it will give the message to this corpus luteum. It will give this message to corpus luteum that I am fertilized. So you keep on producing the estrogen and progesterone, so that if the progesterone will be continuously secreted, then there will be secretory changes in endometrium and there will no shedding. Then this endometrium will not fall down. But okay, but if there is no HCG, then this corpus luteum, what it will think that there is no message from HCG. Okay, so I will let my production down, and in few days, around after 21 days, the production of progesterone and estrogen by the corpus luteum decrease. So if the egg is fertilized, it will produce HCG and the corpus luteum will remain as it is. But if the egg is not fertilized, there will be a decreased production of progesterone and this corpus luteum will start to die. Now this corpus luteum become atretic. So this atretic term is called as corpus albicans. Now there will be no support. to the endometrium, because this secretory changes in endometrium was produced by the progesterone and there is no progesterone, so there is no any support to the endometrium. Now this, if there is no support to the endometrium, this endometrium, what will it will fall down. And this fall down of the endometrium, this shedding of the endometrium, this is known as the menstruation. Okay, so this line is clear. Corpus albicans, so there will be no production of, HCG, no production of progesterone, no support to endometrium, and it will fall down. Now we have to know that when it fall down, I told that there are two layers of endometrium. Okay, there are two layers of endometrium. In endometrium, one layer is intact and another layer will fall down. So stratum basally it will बैठा रहता है भाई, बी से बैठा रहता है, बी से वहीं पे है, बी से basally. So stratum basally will remain as it is, and this stratum functionally, this will fall down, stratum basally will remain intact. And in the second mechanism, there will be decreased production of this estrogen also. So initially what estrogen was doing, estrogen was negatively inhibiting the hypothalamus to decrease the production of GnRH and FSH. Now there will be no estrogen, so this negative feedback mechanism will be cut off. Now if this will be cut off, then again there will be production of gonadotropin releasing hormone and FSH, which will lead to the proliferation phase of the second menstrual cycle. Okay, so I will write this also, that estrogen level will also fall down. So the negative feedback mechanism will not operate. It will not operate, and due to this there will increase of FSH, GnRS, which will lead to the beginning of new cycle. And now there is one clinical scenario that in OPD, if the patient come in the second stage of cycle, it means that she comes after around 21 days. Okay, after 21 days of her menstrual cycle, and she is going to some sacred place like mandir, masjid, or to a long tour. Okay, so she did not want to get her menstrual cycle in the usual period she is getting. So what she do, she go to the doctor and she asks the doctor that she wants to prolong her period. So if in the second stage of she's in the second stage of cycle, then what we do is that we give this progesterone hormone. What it will do, that it will keep the secretory changes in the endometrium, due to which the endometrium will not get shed off, as there will be strong support, there will be support to the endometrium by this progesterone hormone, and the menstrual period is delayed for around 1 to 10 for around 7 to 10 days. Okay, so during that condition we give the progesterone. Now I want to say that there is a we can also divide this menstrual cycle in two phases. The first one is the follicular phase. So this the follicular phase is from here, from hypothalamus this from hypothalamus to this follicle phase. This is known as the follicular phase. Okay, during this production of follicular occurs. Okay, and after that ovulation occurs, and after ovulation the phase which begins is that this is the luteal phase, because in this condition the corpus luteum is produced. Okay, so this is luteal phase. And I want to make you know one thing, that The menstrual cycle is around 28 days. Okay, 28 days, 0, 14 and 28. At 14 days ovulation occurs. Fine. This after 14 days, these 14 days will be fixed. So if the patient is getting menstrual cycle at 30 days, so divide 30 minus 14, because these 14 days are fixed. So if 30 minus 14, it becomes 16. So her ovulation occurred at 16 days. At 16 days, ovulation occurred at 16 days. So we have to know that the second stage of cycle is always fixed. If there is a cycle of 35 days, okay, if there is a cycle of 35 days, then the last 14 days will be fixed. Okay, so this is 21 days. Our ovulation occurred at 21 days. Again we take one example. If ovulation is like at 22 days, sorry, if the menstrual bleeding occurs at 22 days, now again here the 14 days will be fixed. 14 days will be fixed. So this is 4, 6 to 8, so 8 days. So at 8 days our ovulation occurs. We have to know these things, that second stage of the cycle is fixed. Now I will show you one figure. From that figure we will be more clear. So here we are able to see let's see from the last. So there is 0, there is 28, and this 14 days is the period of ovulation. So in the first 1 to 5 days, 1 to 5 days, there is bleeding, there is bleeding phase. Okay, so during this phase the bleeding occurs. Now after bleeding, there start the proliferation phase. So this is the proliferative change. We can see that there is the proliferation, and I have told you that during proliferation, the FSH level, this see this, there is a gonadotropin releasing hormone GnRH released by the hypothalamus, and this GnRH, it causes anterior pituitary to release the FSH. So the level of FSH is increasing. Okay, so this is the menstrual cycle period, bleeding phase. So after bleeding phase, the FSH level is started to increase. Okay, it is started to increase, and while the FSH level is produced by the pituitary, it is stimulating the follicles. So it is stimulating these follicles. Okay, we are seeing that the follicles are getting mature, so it is converting from primary follicle to antral follicle. So here, so during this, the level of estrogen was rising. You can see that in red color, the level of estrogen is rising. Okay, the level of estrogen is rising. So before ovulation, we can see that there is peak in the level of estrogen. So at this peak, what happens? The production of LS is increased. You can see that the LS production is increased. So when LS production is increased, the ovulation occurred. So it is around 28 days. This is ovulation, and we are seeing that after the release of oocyte, the remnant of the follicle, we term that thing is corpus luteum. Okay, so corpus luteum, now this corpus luteum started to increase the production of progesterone. Now here you can see that in the initial phase, the level of progesterone is usually not increased. It is in the same line, but as soon as the ovulation occurs, after ovulation occurs, there is the increase in the level of progesterone. Now at this phase, the when the ova did not get fertilized, then this corpus luteum start to degenerate. So at that stage, the production of progesterone started to decrease. So at that phase, level of progesterone started to decrease, and the proliferative changes which was caused by the this is the proliferative changes. We can see that there is the blood vessels. Okay, blood vessels numbers are increasing, and it is caused by this estrogen. And in secretory phase, there is there is a more coiling. Where here you can see that there is coiling of the blood vessels, and it is causing by the progesterone. Now at later phase, when the ova is not fertilized and HCG is not produced, this corpus luteum start degenerating, and when it start to degenerate, the level of progesterone falls, and the secretory changes, which was caused by the progesterone. When it dropped to the baseline level, then it started to set off, and it started to set off here. Here we can see that it started to set off, and we see this set off of endometrium is the menstrual bleed. Okay, and the set of this corpus luteum we term, and the atretic corpus luteum is called as corpus albicans. So by this I have completed the menstrual cycle. If you like this video, please subscribe my channel and get more interesting video in the simpler form, and please do not forget to subscribe and share this video to your friends. Thank you so much.